Okay, I'll introduce you to the panel. You've met me already, so I shan't introduce myself. We have Mary Cox, who spoke to us not so long ago. We have Amanda Churchill. I should read out her title for you, which is Consultant Senior Lecturer of, and I hate saying this word, Ophthalmology. I'll want to say. Then next to her we have Veda-Jayne Petre, who's a Disability Rights Advisor. And then we have Victoria Towell, who spoke to us this morning. And on the end we have Jenny Langley, who's a Trustee of ANUK and our Inquiries Officer and the Patient Representative for International Wagner Syndrome Association. So hopefully, amongst all of us, we'll be able to answer the questions. Now I'm sure you appreciate, there's a lot of you here today. I'm sure that a lot of you will want to ask questions. If not, I have an emergency list of questions. We want to get as many people as possible to ask questions, so if you could keep your question as brief as possible, and also as general as possible. I know that a lot of you will have personal burning issues, but we really want to get questions that people all get to do, ideas and what they want to hear. Some of the panellists will be here at the end, so if you really need to speak to them, if they're here, I'm sure they're happy to. Or do contact us at ANUK. Jenny, who's the Inquiries Officer, she will send your inquiry to anybody else that can help you. So if you don't get done what you want to do today, do that, because it's really helpful. Okay, what I'm going to do is, people put their hands up, they want to ask a question. I will come to you for you to ask the question. I will then take the microphone away, so you can't hold on to it the whole session. Yeah, I'm not silly, I've been here before. And then the panel will decide who's going to answer that question. Okay? So, who'd like to start the rolling? Don't let me down. Come on, somebody's got a question. I don't want to go to my list. Okay.
Is it true that the eyes continue developing into the late teens, early 20s, and therefore in surgery it's better put off until they're fully developed?
That's a very good question. I think that's probably going to somebody who knows the medical answers to that. Thank you, Amanda.
Very interesting question, and actually the answer is it depends which part of the eye you're talking about. So, for instance, if we were talking about somebody who had a severe cataract, then we would want to operate on them. If they were born with it, we would want to operate on them within about 8 weeks of life, so between 6 and 8 weeks. So you wouldn't want to put that off, because you need to have a clear pathway for the light to get to the back of the eye, for the brain to recognise it. But there are other parts of the eye, so in that situation you want to operate it early. There are other conditions that may affect the eye that don't come on till later, so you would want to treat those as and when they cause problems. So there isn't a sort of one answer to that. It really depends. The eye is developing, and some parts of the eye are renewing themselves throughout life. Other parts tend to develop, for instance, your vision tends to lock on roughly at about 7 years of age. So after that, you've got less chance of improving your vision by doing things to it to stimulate it. I hope that helps.
What clear, concise questions and answers. Very impressed. That was really helpful. Okay, who's next? Over the back, Susan. Okay, I'm heading this way. I feel like Jeremy Paxman, or who's that other man that does it? Jeremy Kyle.
Just in general about PIP and mobility, with it changing, what's going to happen with the DLA and the PIP side of things for in-betweens?
Okay, you clear about that one? Who wants to answer it?
Yes, I'm the lucky one who's got the answers one.
Sorry, button was on the wrong side. Never trust a blind person with a microphone. Right, at the moment I've seen stand, DLA for children will continue. So anyone up to the day before their 16th birthday will carry on with disability living allowance, both the care and the mobility components. It's open to change, but at the moment there are no signs they're going to change it. However, for anyone who reaches their 16th birthday up to the day before they're 65, they will now have to apply for personal independence payments. There is a mobility part to that, but if you're registered blind, you will not be guaranteed the higher rate in the same way that you would have been with DLA. The mobility part looks at how you manage if you use a mobility aid. It still does look at whether an area is familiar to you or not in a similar way to the DLA does. So at the moment for children it's fine, it's not a problem, you just carry on with the existing system. It's adults, it's the PIP who have effect right now. Does that answer it?
Yeah, that's fine. Next. Come on, don't be shy. You've got some burning issue that you want to ask. We answer all your questions today. I'm going to have to go to the list. Not trip over the dog. Okay. These are questions that have been sent to ANUK various times. So this one I'm quite interested in hearing the answer for, because I know James used to do this, and I know quite a lot of people used to drive us mad with this one. Many people with Aniridia have reported enjoying shining lights into their eyes when younger. Why might this be, and should a child be stopped doing it? I know James had one of those projector things, and he used to go in the cupboard under the stairs and just shine the light in his eyes all the time. He was a strange child. He spent a lot of his life in the cupboard under the stairs, unfortunately. Especially when the health visitor came around and said, "Where's your son?" And I said, "He's in the cupboard under the stairs." Awesome. Okay. He's turned out fine, though. So who'd like to answer that one? Anybody got any ideas?
What I was just going to say is that there isn't something particularly specific about this other than if you're very, very poorly sighted, then you get some positive benefits, like some stimulation out of just seeing lights and coloured lights. It's just because rather than having a very dark world, you like being able to see something, and if that is all you can see, then that is something that you might find nice, really, just to be able to see something, so you'll shine a light in your eye. It's not a good thing, because there are some parts of your eyes that can be damaged with very bright lights, in the same way that you see these little laser pointers, and there's a lot of discussion of ophthalmologists at the moment with children who can buy these on the internet or in shops on holiday, and they're shining the lights in their eyes just because it's just one of those things. Children explore, they try things out and think, "Oh, this is great, let's have a look at it in more detail." And it can burn parts of the eye. Now, because you're looking directly at it, you're burning the central part of the eye, which is called the macula, which is the most important part of your eye for detailed vision. So you can permanently damage your sight if you look at something that is very intense in brightness. But most of the time, children who are poorly sighted are not using things like that. They're using just coloured toys, flashing lights, which actually they're getting some pleasure out of using, and I think it's unlikely in those situations to damage their eyes. So I think if they can get something out of it, don't stop them, but be aware that if it's a very bright light, it could cause harm.
So it's okay, James, you're all right in the cupboard under the stairs. You can go back there now.
Just on the note about bright lights and things like that, Tora sits very close to the TV. It was difficult to get my son to not sit near the TV as well. Is that also quite not good for them?
Some people with aniridia are actually short-sighted as well, and they will therefore not be able to see things from a long way away, and therefore they will naturally either hold things very close to their eyes to see or sit close. I would not discourage that. I think that's absolutely fine.
Also because of their nice smell.
And also because of their nice diagnosis null point, they may want to hold something close because it makes things a little bit clearer for them. So that's fine. If a normally sighted child is sitting next to the television, we would try and discourage it, but it's often a phase children go through, and if they've got a sibling doing it, then they may well be copying it. It's not going to cause them any harm, it's just it tends to irritate the parents because it's
Did you all hear that? Did you all hear that? No, some of you didn't. If I give you the microphone, Heather, perhaps if you say it again.
My daughter Aniridia likes to sit in front of the television right up close, so as a family it's about trying to keep her sister out from in front of it, but also if we can get her sister away from the television, we've always got a little head in the way, so my husband's managed to get, I think it's a 7-inch monitor, and hook it up to our TV, so actually Zoe can sit on the sofa with everybody else holding her own monitor, her own little TV, because it's smaller, she prefers watching that, and then obviously nobody else has a little head in the way, and we can encourage her sister to watch television from the sofa and not be right up in front of it. I don't know how he did it, because I'm not technical. I don't think he did it that way. I don't know.
Perhaps you could let us know.
Yeah, he did say. I want somebody to say that could use the particular monitor we've got. There are other ways of doing it as well, kind of thing.
But if you could ask him, and then we could put that for people to get hold of, that'd be really good.
Yep. I wanted to say we've had on the Aniridia Families Facebook group, there's been a recent discussion on TV and TV watching with people with Aniridia. It started by one parent posting a photo and saying, does your child sit this close to the TV when watching it? And I believe James did a blog article summarising a lot of the comments, so go on our website and have a look at that, because that gives a lot of experiences and of different people.
I also think this thing about sitting too close to the telly is also a bit of a throwback on the old CRT TVs, where there was a lot of radiation given off by those types of screens, which could be harmful to people sitting too close to them, whereas you don't get that with the modern flat screens.
I didn't understand a word of that. Far too technical. Thank you for your comment.
I also like my iPad to hold up to my face and get it at the right angle rather than watching on TV. I find it quite good to have something portable and adjust it at the right angle, so like a phone or an iPad.
I think the other side of that also is the social side of being a family. That you're all on the settee, all cuddled up and nice, and this child's very isolated. So I think anything you can do to actually include it within the family is really, really important.
Teenagers in Germany and in America, they use special glasses. I have on my website, and they maybe Aniridia family was post about. So just glasses, which is working like make a situation bigger, like if you go theater, for example, so the same system. So and teenagers love it. So that's what because for smaller it's a little bit difficult to organize for smaller kids, but for teenager, maybe from 7-8 years old, they can feel what is comfortable because these glasses has something to regulate, they can do it. So the exit also.
Thank you. If anybody wants to know any more about that, speak to this lady. Yeah.
This is probably for people that've got more severe eyesight problems. What sort of pastimes did you have, apart from TV stimulation, to stimulate yourself during the day? What sort of stuff did you do? I mean, we've got a child that's probably going to be severely impaired and not be able to watch TV, so what sort of stuff could we do for him? You know?
I think I know what you might say to this one.
Yeah, what I mentioned, carry on. Ranged through different ages. Certainly the radio has always been a key thing, and radio nowadays, you've got the 4 o'clock show on Radio 4 Extra that is for children. There isn't as much radio for children as there used to be, but that is one programme that's aimed at them, and it's equality, if you sort of mean. I always was encouraged to go swimming because that was a sport that I'd always be able to do, however much my sight reduced, and I do that. Also, we've got things that I think we've got up on the Aniridia website, things like special games like visual impairment cricket and other things like that. And I go to tandem riding, and they've got group for young children as well, for children to be able to go around on special bicycles in an arena, so that's safe, and that's quite fun. So it's joining in with other children, social things, and things with my hands, very much Play-Doh and Lego, the old-fashioned Lego. There wasn't any fancy bits when I was a child, but certainly loved all those sort of hands-on things. Jenny, do you want to talk?
Yes. Very similar to Mary. Reading, I loved as a child. I now read with my iPad on iBooks with the speech, or listen to audio books quite a lot. And there's some brilliant children's books. Quite a lot of the Jacqueline Wilson are on audio, and also Braille. I read Braille and teach Braille, and I also used to go horse riding quite a lot. Weekly horse riding lessons. I did weekly trampoline lessons, and I went swimming, as Mary said. Went to cadets, first aid courses. Quite a lot really. I was never really held back from anything. I tried it, and if it didn't work, then they tried to find a solution to make it work.
Last year we did tennis. I think it was called blind tennis. And I was the worst person at it. All of those people who were visually impaired much better. We just were. And also story sacks are brilliant, which is using for young children well-known stories like Spot, and it has all the things cut to the story. They are quite expensive, but they're really easy to take yourself. So get a book, get an old pillowcase, and put the stuff in. It's really good. And there's also, I think if you put in sensory story sacks, there is a company that does stories with lots of sensory stuff in it, so it has smelly polish and stuff like that, and they're quite good. What do you want to say?
I was just going to add music. I absolutely loved my music lessons, and I still get a lot of pleasure. I don't have lessons, and I don't play in a concert or anything, but I just get a lot of pleasure from pootling away at home with.
That's what I'm looking towards, hobbies sort of thing, you know.
Yeah.
So you could get interested, so you could take up.
Yeah, and I mean that's something. With so many things like music, like the swimming, that you can just take off as seriously or as little as you like. The other thing I was going to mention was Living Paintings, who are a library that do books with sort of tactile thermoform pictures, and then they're on the cassette as well, and they will talk you through the picture, and they're really good as well.
You wanted to say something?
I was just going to add to that point actually. I was going to say that there's a lot of sports that they can still do. You know, you can look at, for example, blind football, partially sighted football, cricket, various sports. So there's nothing really stopping him. I think once he's old enough, you can maybe put him forward, see how he copes with it.
I'm looking for an everyday thing, sort of an everyday holiday.
Okay. Difficult in terms of that, I'm not sure, but just another idea.
I think those of us who have children who are visually impaired will probably say that there's nothing they can't do. It's just finding ways to adapt things and to make it better. If they show an interest in it, then let them go with it. The main thing is to make them safe, really. Yeah. I think there's nothing you can't do. It's just making them safe, especially if they're little. If it's something that's got small parts, then obviously you have to be careful with that. But I think going into it thinking they can do whatever they want and then just adapt it. Keith, did you comment?
I want to comment on that question. My comment will be also, if you don't know, there's all the description on many TV stations and programmes these days, so potentially worth looking into that, because as a visually impaired person, when I watch a show with all the description, it really gives me an extra bit of detail that makes it much more interesting to watch. I did want to ask a completely separate question to that. For those of you who, a bit of my personal situation, my pressure in my eyes is still in a safe zone on the kind of bordering on the high pressure zone. Just wanted to ask experiences of people who've started on pressure drops, and do they find this open a kind of can of worms that pressure went too high, too low, and it kind of, or did they find this going on one drop and it stayed, it went down a few points, just went off the critical points, it was all fine from then?
So, Amanda, do you want to make a comment on that first, or do you want to see what other people say?
Well, actually, I'd be interested in what other people say, and then I don't mind.
Anybody want to make a comment to that?
Yes.
Sorry?
I've noticed one thing that when we're putting pressure drops, we're getting a lot of bloodshot eyes these days. And I'm just wondering, do they have a longevity to the point where they become useless and start making things too
Do you want to hear a couple more comments?
Yes.
Okay, so I think it was Keith that first question, wasn't it?
It was, yes.
So I think it's a very individual basis, work for your pressure. Some eye drops work for some people, and others it doesn't work for. I know somebody who I think was diagnosed with glaucoma about 12, and they've always been on eye drops and not needed any surgery, and they're now in their early 30s, I believe. And I was 5 when I was diagnosed with glaucoma and had eye drops and needed surgery straight away because the eye drops didn't work. So I think it's a very individual thing, and that goes through all the stages of glaucoma. So even after surgery, sometimes drops work, sometimes they don't work, and it's a very narrow thing. Sometimes drops work for a while, and then you have to change over to have 2 drops, or 2 different types of drops, or 3 different types of drops a day. It's a very different trial and error thing, I think. And the bloodshot eyes, are the drops used preservative-free or not?
Yes.
Yeah, they are preservative-free. I would probably worth consulting with the ophthalmologist about that, because that's, again, a very individual thing, I think, about what drops might work instead of the ones that you're taking with.
Thank you. Deborah, did you have a question? Or did you want to comment to that?
point, really agree with what John's use the microphone.
I know you've got that.
Just agreeing with what, I can't remember your name, what you've just said, Jenny's just said, with the drops, it depends on the individual, because drops really only are to control it, but they don't always control it, depending on what drops they are. But it does depend on each individual, because I've been on drops, and I can maybe not take the drops, and the pressure will stay low, and then they go high, and then even though I've taken the drops on a regular basis and it's gone up high, and the consultant has told me that I need to keep using the drops, but even though I've used the drops, it's gone high. But when I haven't used the drops, it's stayed low. So it's not always the case that the drops work. Depends on the individual.
I'll just add a tiny bit, just to say that everything Jen has said is absolutely right. It depends on the eye drops you're using, it depends on the individual, it depends on the age. There is a bit of a generalisation though that I could say, which is if you get glaucoma in childhood, it is often more difficult to control than glaucoma later on, in that quite often you'll find children have a more aggressive form of the glaucoma and may need surgery earlier than an adult who may just be controlled with eye drops. The eye drops do have, there are so many different sorts and they all will control the pressure in different ways. So you may be on one that's reducing the amount of fluid being produced, you may be on another one that's improving the outflow of the fluid from the eye. So there are all sorts of different combinations that can be used, and if one isn't agreeing with you, for whatever reason it is worth going to see your ophthalmologist to see if there's another one they could try. Preservative-free drops are better in general, as I'm sure you're all aware. People with Aniridia, because of the potential toxicity of the preservatives to the cornea. The final thing I just want to say is that your pressure does vary at different times of the day. So it may be that you were tested at one time in the morning and at another time in an afternoon clinic. So don't get too hung up on 1 or 2 millimetres of mercury change. It's general trends that are more important to your eye.
Thank you. There's just a question here, but along the same lines, which is glasses. There you go. Hydromor and other eye drops for dry eye are available to buy online. So if you pay for medication, is there any point in getting a repeat prescription?
I think it depends how much you're paying online for. Basically, it just comes down to the money side of things.
Okay, but it's okay to do it.
As long as you're happy with the source of these drugs.
It's very interesting what you said about the preservatives, because I asked my daughter's consultant about preservatives, and she's had lots of eye drops that have preservatives, and I said, I've heard a lot about this, what's it, why are people saying this? And he said, oh, it just irritates eyes, she's fine with preservatives. And now I feel,
No, not all drops come preservative free, so sometimes you just have to accept
when I
it.
said to him, I've heard about this, he just said, preservatives will irritate an older eye, don't worry about it in children.
There is a little bit of truth in the sense that your cornea is likely to become sicker with age because of your stem cell problems, and therefore your eyes need to be more robust at a young age, and therefore more likely to be able to tolerate preservatives. But there's somebody
Colin would like to comment.
I think if you can have the medication preservative free, I would always go preservative free, both for lubricants and glaucoma treatment. And some of the reason for that is that it's back to you get clouded by what you see in life and medicine. So if you're under a pediatric ophthalmologist, they don't always see the corneal disease that happens well, I would still say preservative free because there's evidence that the chemicals within the eye drops are toxic to the ocular surface, and if you've got a genetic predisposition to have a diseased ocular surface, to me it's a no-brainer that you wouldn't use preservatives if you had an alternative that was equally effective that didn't have preservatives. And that goes for the dry eye drops as well, the lubricants. And there is even evidence that some of the constituents in the preservatives can actually, in adults without aniridia, can damage the actual drainage system. So I would, if someone's got ocular surface disease in adulthood who doesn't have aniridia, I would use preservative free, and if they have aniridia, I would remove any risk that I would do anything that would damage the stem cells further, even if it's theoretical and there's no evidence base for that. I think to me it's a risk. I'll just mention about the dilated drops because Veronica told me to. The drops aren't just designed to dilate your pupil, they relax the zonules, the little ligaments that hold the lens that we focus with. So if you want to accurately measure the child's spectacle error, you still have to use some of those drops. They're all the little lens ones that we use in the clinic were all preservative free. But if you were on glaucoma treatment, you're on that from a young age, and you're going to be on that potentially for life. That's why I think you should use preservatives if you can. And there used to be one or two choices, and one of them wasn't that effective. But now there's a whole range of medications preservative free, and there are even variants that have preservatives, but they don't potentially affect human cells. So even if you couldn't get it particularly preservative free, there are ones that have a different preservative in them. So to me, that would be my take-home message. I think if it was my child, I wouldn't be able to make preservatives.
And I do want to say though that if you've got a glaucoma drug that's working really well, then it might be too risky to change to a preservative-free one, possibly.
If it comes in the same class, then I would still go preservative-free. And there's a lot of debate whether the preservatives help the drop work, and there have been lots of studies in Europe that show that the preservatives don't make it. So some people feel that the cornea gets a bit leaky because the chemicals damage it a little bit, so that's a drop in, but there was no evidence case. So I think, if you've got a drop and it's exactly the same drug, and you can get it without the chemicals, when you change to preservative-free, the drug's the same. It's just an individual little unit.
Yeah, but I was just talking about different families of drops. They don't change to a different one.
No, but a lot of them do come preservative-free. Is it? Well, okay. Well, do you want to talk about is it preservative-free?
It's not.
He can. You can.
How do you get it then?
It's on prescription.
Right. I know you can get a lot of drugs.
Yeah, well, basically, Lumigan gives you a bit of red eye. There's the two different drug companies. One went non-human type preservative, and the other one reduced the strength but upped the preservative to get rid of their red eye that they were generating. So they actually increased the amount of preservatives in Lumigan, although they reduced the strength of the drug. And they realised that they didn't really get rid of the problem, so now you can get unit dose Lumigan and unit dose Ganfor and all of those medications, all available.
The one that we're on.
It's exactly the same drug, but it just has no chemical. A true stop comes unit dose. Timolol was a beta block that comes unit dose.
Yeah, we've got the taxol
Yeah. So the number of drops that are now preservative-free have increased because the drug companies realise that even in normal people, the preservatives can have a detrimental effect. So the range has increased. So